Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Screening for Alzheimer's and dementia with memory tests. Doctors use several assessment tools to diagnose Alzheimer's disease or other dementias, including tests that evaluate cognitive skills and memory. The results of these tests are sent to your healthcare provider, who will work with you to determine the next steps in evaluation or care. /r/n/r/n tests for dementia provide one piece of the puzzle. They should not substitute for a full diagnostic evaluation, which may also include imaging and blood tests. /r/n/r/n This article reviews common tests used to screen for dementia and offers insight into what happens after you get your test results. /r/n/r/n Persons who show the following early signs and symptoms of Alzheimer's or dementia should get screened. /r/n/r/n-FatCamera, Getty Images /r/n/r/n The MiniMental State Examination, MMSE, is widely used and reliable in detecting Alzheimer's disease, available since 1975. Taking about 10 minutes to complete, the MMSE measures aspects of cognition that include orientation, word recall, attention and calculation, language abilities, and visual construction. Scores may need to be adjusted or interpreted differently to account for a person's age, educational level, and ethnicity/race. /r/n/r/n The MiniCog is a rapid Alzheimer's screening test that takes only 3 to 5 minutes to administer. It combines a 3-item recall with the ClockDrawing Test and can help to determine whether someone does or does not have dementia. Although the test is widely used and reports have been positive, a rigorous research review reports that more evidence is needed to recommend its use as an accurate screening test, and as with other screening tools do not substitute for a thorough diagnostic workup. /r/n/r/n The Montreal Cognitive Assessment, MoCA, is a relatively simple, brief test that helps health professionals determine quickly whether a person has abnormal cognitive function and may need a more thorough diagnostic workup for Alzheimer's disease. Unlike the MMSE, the MoCA includes a ClockDrawing test and a test of executive function known as TrailsB. It may predict dementia in people with mild cognitive impairment, MCI, and it has been shown to identify cognitive problems in people with Parkinson's disease and other neurodegenerative disorders. /r/n/r/n The St. Louis University Mental Status Exam, SLUMS, is an 11-item Alzheimer's screening test that is especially good at identifying people with milder cognitive problems that don't yet rise to the level of dementia. It has been studied with hundreds of veterans and includes items such as the naming of animals, similar to a verbal fluency test, and recognition of geometric figures. /r/n/r/n The AD Informant Interview is an 8-item questionnaire that distinguishes between people who have dementia and people who don't. It is considered an informant-based assessment because instead of the patient being questioned, the patient's informant, usually a spouse, child, or non-family caregiver, is asked to assess whether there have been changes in the past few years in certain areas of cognition and functioning. These include memory, orientation, executive function, and interest in activities. The AD8 has a yes or no format and takes only 3 minutes or so to complete. /r/n/r/n The ClockDrawing Test is a simple test that is often incorporated into other Alzheimer's screening tests. The person is asked to draw a clock, put in all the numbers, and set the hands at 10 past 11. Abnormal clock drawing tests suggest problems with memory, executive function, or visuospatial abilities. /r/n/r/n This short screening asks the test taker to repeat 3 words immediately after hearing them. Next, 2 tasks that distract from those 3 words are performed, a short version of the verbal fluency test where the person is asked to name as many animals as they can in 30 seconds and spelling world backward. Finally, the person is asked to remember and recite the 3 words from the beginning of the screening process. /r/n/r/n. This screening test has been shown to be effective in identifying mild cognitive impairment, a condition that sometimes escapes detection with other screening tests. The 7-minute screen involves enhanced cued recall, orientation questions, verbal fluency, and the clock test. /r/n/r/n. The SAGE at-home test is designed to be used at home and then brought to a physician for review after completion. It evaluates several different areas including memory, orientation, executive functioning, language and naming abilities, and visuospatial abilities. /r/n/r/n. After you complete the screening tests, your healthcare provider will evaluate the results and then share them with you. /r/n/r/n. If your tests indicate you are not showing signs of dementia, your healthcare provider may keep your results on file as a baseline for the future. They may also recommend other types of testing to determine the underlying cause of any cognitive symptoms you may be experiencing. /r/n/r/n. Keep in mind that there is no single test that can determine a dementia diagnosis. You may need to complete a series of tests to rule out an underlying physical cause of your symptoms. These tests can include /r/n/r/n. A variety of tests, like the Montreal Cognitive Assessment MoCA, are used to assess cognitive skills and memory in order to screen for conditions like Alzheimer's and dementia. /r/n/r/n. Remember that screening tests are just that, tools that help identify possible concerns and determine if more complete testing would be appropriate. If a screening test indicates a potential problem, you should be fully evaluated by a physician to determine if there's a reversible cause for your decline in cognition or to consider treatment options if dementia is diagnosed. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.